I'm Dr. Harris, and I'm gonna be doing, nurse Dr. Harris, not a physician Dr. Harris, but I'm gonna be doing your head-to-toe assessment today. Can you tell me your name?
Susanna McMahon,
Okay, and your date of birth.
3/25/2000.
Okay, what's today's date?
I think it's November 6th,
Okay, and the year, let's make sure you ask the year.
2020,
2020, okay, tell me where you are.
Benedictine College.
Okay, and tell,
Nursing department.
nursing department, okay, very good, and tell me why you're here today.
I'm here for a head-to-toe assessment,
Okay.
but also school. So.
Okay, all right, well, I'm glad you can do all of that at the same time. Are you having any concerns, any pain, any health problems at all?
No, ma'am.
Okay, do you have any family history of anything significant?
I don't think so. Like cancers, but
Okay, so no pain, no trouble getting around, no concerns. Okay, all right. So let's go ahead. Are you allergic to any, there's a little cheat sheet here. Are you allergic to anything at all?
no.
And if they were allergic, what are we gonna ask them?
What's the
What
reaction?
type of reaction? Okay, very good. Have you ever been to the hospital at all? Okay, so no history, any history of surgeries?
No.
Okay, any current medications?
No.
Okay, all right, well, looks good. So we've already done the first 5, 6, 7, 8, 9 points, okay, guys, out of 100 points. Okay, so I'm just looking at your face. I'm looking to make sure it's symmetrical. You guys cannot have your cheat sheet when you do it, just so you know. I only get it because I haven't looked at it. We weren't gonna do this today, so. Okay, smile, okay. And I'm gonna look at your skin, nice and pink, just looking. And I'm gonna look at your, I look at your lips, and I'm gonna look at your hair and your scalp. I don't see anything concerning. Okay, we're gonna look at your vision. We've already checked your vision with the Snellen chart, the far vision.
Are we gonna do that in the
No,
checkup part?
no, gosh, I don't have time to do that.
Okay.
I'm gonna have you go ahead and read this for me.
Health assessment A.
Okay, very good. So just looking at your eyes, your eyelashes, eyebrows, everything looks good. I'm gonna go ahead and check your pupils. So I'm gonna have you just look here at my nose, and I'm gonna shine this light in your eyes. Okay, good. And look here at my finger, and now look back at all those people watching you the side, okay, and back at my finger. Okay, good, nice perla. I'm gonna use the ophthalmoscope now to look in the back of your eye. So what I'm gonna do is I'm gonna turn down the light. You guys definitely need to turn down the light. This is something I want you to practice next week too in class, because sometimes students, you haven't done a lot, it's kind of struggle. I'm gonna turn down the light, and I'm gonna have you look straight ahead. Remember, right eye to right eye, left eye to left eye, right? I don't wanna cock noses. Just look straight ahead. And I'm just gonna, red light reflex is present. We're just gonna do basic again. So look straight ahead again. Okay, red light reflex is present, nice job. Okay, so now we're gonna go ahead and I'm gonna look at your ears. I'm gonna have you, and we're just gonna check your hearing. So I'm gonna have you close one ear, and I'm gonna whisper something I want you to repeat after me.
We can get through this semester.
Okay, the other ear.
I'm proud of how much we've learned and how hard we work.
Okay, good. I really do mean that, you guys. Okay, let's look at this ear. So the external part of your ear looks good. Go ahead and look at your tympanic membrane, and everything inside looks good. I can't see your tympanic membrane in that ear because you got some wax. It's okay. It's okay.
This was last time too.
I know. So, you know, your right one looks good though. Okay, so now I'm gonna go ahead and look in your nose, and maybe just pull your mask down a little bit. I'm just gonna look outside your nose. Looks good. It's nice to see you guys without your masks on. Okay, just gonna look inside here. Okay, good. Now I'm gonna have you go ahead and Yep. Oh, she knows exactly what I'm gonna do. Okay, lips look good. They're nice and dry. Open up. Say ah. Okay, I'm gonna have to get a stick, which I didn't bring. Pretend I have a stick. Okay, hold on. Oh yeah. Okay, good. I don't need a stick. Okay, let me see your teeth. And your gums all look good. Since I have your mask off, you want to stick out your tongue and wiggle it back and forth? Okay, good. Go ahead and put that mask back on for me. I'm gonna go ahead and check the rest of your cranial nerves while we're here. Okay. Can you feel
Yes.
this okay? Okay, good. I'm gonna have you follow my fingers with just your eyes. You guys do not have to do this in the same order. You don't have to follow the same order on the sheet. Just make sure that you, my little tip is to be consistent every time you do it. My other tip is, if you forget something during the exam, save it at the end, because if you go back and do it out of order, you get discombobulated, and sometimes students are like, oh, I don't know what to do now. Okay. Okay, so we looked at those cranial nerves. I'm gonna have you move your head to the right, to the left. Okay, shrug your shoulders for me. Smile real big, frown, puff out your cheeks. Okay, raise your eyebrows. Okay, you're good. Go ahead, check your lymph nodes. I don't feel anything enlarged. I don't have any tenderness.
Do we have to verbalize which ones were?
Okay, all right. All right, you guys, look, we're done with the, your trachea. I'm gonna feel your trachea, it's midline. I'm gonna feel your carotids one at a time. Okay, I'm gonna have you swallow. I'm just gonna check your thyroid. Okay, swallow again. Is that tender at all?
No.
Okay, cranial nerves, we're almost done. I'm gonna have you stand up. We're gonna do the Romberg test. I'm gonna have you just kind of stand like this. Hands at your side. Close your eyes. 20 seconds passed. Okay, good. No swing. So that's negative. Go ahead. You can sit back down. Did I forget anything with the cranial nerves? Somebody want to grab me a stethoscope out of there? They're right around the corner. Corner to the right. That's a teaching one. This is where we can listen at the same time, right? Okay, middle word. You'll get the idea. Okay, I'm gonna go ahead and I'm gonna listen here to your heart first, okay? Okay, very good. And I'm gonna listen to your lungs while I'm on the front end. The anterior part. Yep, deep breaths. Okay, good. So I'm gonna listen to your lungs back here on bare skin. So can I listen under your shirt?
Mm-hmm.
Okay, take some deep breaths. Okay, good. I'm gonna do your respiratory expansion next. So I'm gonna have you take a deep breath in and out, okay? Okay, good. And now since I'm in your back, I'm gonna check CVA tenderness on here. Hold on. I don't think I have it on it. Okay. All right, good. So now I'm gonna have you lay down. We're gonna check the belly. Okay, so I'm just gonna look. I won't really pull up your shirt, but normally, right, I pull up her shirt and really look, make sure I'm checking for scars, looking for anything like that. So after I look, make sure you listen second, right? You guys, we gotta auscultate second with the belly. The other systems I don't care as much, but. Did you eat breakfast?
No.
I'll ask you a question, you don't have to answer it. When was your last bowel movement? You don't have to answer that. Okay, I'm gonna go ahead and fill your belly here, okay? Make sure you watch your patient's face. Okay, good. And I'm gonna go ahead and percuss. The only time you have to percuss is on the belly. Can you see that? Okay, all right, very good. Now I'm gonna have you sit on up. Go ahead and check your cap refill. Okay, good. Fingers are nice and warm. I'm gonna go ahead and check your pulses. Okay, we're gonna go ahead and do your deep tendon reflexes while we're here. Anything I have in italics, you have to tell me what you're doing. So, I do have to name your pulses here. So, radial, ulnar, brachial pulses. Thank you. Okay, let's check your reflexes. Brachial, radialis. Try to relax here, okay? Oh, did you guys see that? Okay, good. I'm gonna do your biceps here. Good. Your triceps. You relax.
Oh.
Not relax. What are you gonna do this weekend?
That's a great question.
Study, study.
Probably.
Okay.
Might do the focus assessment test. We'll see.
Okay. Let me see your. Let me have you take your shoes and socks off for me, please. Thank you. Okay, so I'm gonna check her pedal pulse. Cap refill, which we can't really do, but tibial pulse. L plus 2. I'm gonna check you for edema. Can I pull this up a little bit? Okay. A little trace of edema. All right, and then let's check your reflexes here. So I'm gonna go ahead and check your patellar reflex. I should have made sure you could reflex before I let you be my
And you
patient.
tested them last time. And they didn't
I
work.
know, I remember now. Just relax here. Okay. Oh, we got that one. Okay, I got that one too. Okay. Yeah, nobody's gonna want to bring you in as their partner. Got him. Okay. So guess your patellar and your Achilles there. Okay, so let's go ahead. We're almost done. Stand up. You can put your shoes and socks if you want. If not, it's fine. Okay, so I'm gonna have you walk over the corner and come back. Okay, good. And now I'm gonna check you for scoliosis. I'm gonna have you go ahead and lean over, touch your toes. Can I pull your shirt out?
Yeah.
Okay. Hips are equal. Come on, look at her spine here. Nice aligned. Shoulders are equal. Okay, very good. We're almost done. Actually, we are done. Did I forget anything? Somebody falling off with their head to toe?
Do you have to do jugular vein distension?
Nope. Just the carotid. Nope. Okay. That's it. Thank you very much for being my patient.